Good morning, everybody. We are back to the press room with Commissioner Janez Lenarčič, who is, of course, in charge of crisis management. Now, the Commissioner will make a short statement about the boosting of the strategic medical stockpile and the RescEU, following which we will also take a few questions. Commissioner, please take the floor.
Thank you. Good morning. As you are aware, the COVID pandemic has exposed some serious vulnerabilities in how the international community responds to global emergency, like a pandemic. And one of the most striking issues at the start of this health crisis related to the limited availability of personal protective equipment and also other vital medical supplies worldwide. This situation, this concern, was shared by many countries, including our member states. If you recall the state of play at the end of February, most member states had limited stockpiles and struggled to provide the necessary supplies for their own needs as well as for others who asked for assistance. In response to that situation, the Commission quickly undertook a series of steps to ensure that no member states would ever fall behind in the same manner again. We took action primarily on two tracks that continue. First, in March, we established a new RescEU life-saving medical equipment reserve. Through this reserve, by now, more than 500,000 units of FFP2 and FFP3 protective face masks have already been delivered to Italy, Spain, Croatia, Lithuania, as well as North Macedonia, Montenegro, and Serbia. These are professional masks intended for first responders like medical staff, civil protection teams, police, and the like. With winter approaching and coronavirus cases increasing throughout Europe, it is crucial that we continue to build up our stocks. In this view, I am happy to inform that Denmark, Greece, Hungary, and Sweden have joined Germany and Romania as host states of the RescEU medical stocks. With 100% financial support from the European Commission, 6 EU member states are now in the process of building a common European stockpile of life-saving equipment and other vital medical supplies. These reserves are to be distributed throughout the European Union at times of medical emergencies when national health systems would be simply overwhelmed. The second track started in June when the European Commission put forward a targeted proposal to strengthen the European Union's crisis management system, including the European Union's civil protection mechanism. The objective of this proposal is to provide the European Commission with more tools to support European Union member states as they seek to prepare and respond to complex disasters. This proposal will also help strengthen the European Response Coordination Centre. This proposal aims at the following. First, better preparedness by creating a RescEU strategic reserve at EU level, plus the possibility for the Commission to directly procure capacities. Second, faster response. As to once a disaster strikes, we should be ready to respond immediately by disposing a logistical capacity to ensure timely transport and delivery of assistance. And third, improved risk management and planning for high-impact emergencies through the development of EU resilience goals. I would like to clarify here that it is important to note that these strategic capacities will be supplementary to those of the EU member states. The fact remains that civil protection is the national capacity of member states, and the European Union is to play a supportive role. We would like to preposition strategically this capacity in such a way as to ensure the most effective geographic coverage in response to an emergency. To conclude, with the increased number of host states, RescEU is stepping up our preparedness. With these new measures as well, we will be much stronger in fighting this current pandemic, as well as better prepared for possible other crises in future. In view of the July European Council agreement that has topped up the total budget for the civil protection to 3 billion, I also count on the Council's and Parliament's continued support in this endeavour. With that, I'm happy to take a few questions.
This is the time for us to take a few questions. I see many hands up, which shows the important interest in this topic. I will start with Maria Sara.
Good morning. Can you hear me?
Yes.
Now?
Yes, it's perfect. Please go ahead.
Okay, thank you. Thank you, Commissioner. Thank you, Vice President. First of all, I have two questions, if I may. The first one is, Greece is from today participating, but what does that mean in practical terms? If you could elaborate a little more, what all these countries and how will act now that they are part of this initiative. And the second question, if I may, is about Lesbos. If you could inform us about the state of play of the help of the member states to Lesbos, it would be very useful. Thank you very much.
Thank you. The RescEU in practical terms works like this. We need member states who procure and store on behalf of the European Union the medical capacity, the reserve strategic capacity for a situation of a crisis. This system does not replace the national responsibility. Civil protection, as I said already, is national competence. That means that every member state is responsible to have sufficient stock of the necessary capacity, of the necessary items and materials in order to face possible crisis situations. But we know that some crises are of bigger magnitude than others, and it often happens that national capacities are overwhelmed. For that situation, we have the Union Civil Protection Mechanism, through which a member state can ask for assistance, and then other member states may respond and offer the items requested. Then we have the third level, when there is an extraordinary crisis, like this pandemic, when everybody is facing similar challenges, and in such situation, we also have the European level reserve, the so-called RescEU. But for that, we need member states who procure and store these reserves for that purpose. So in practical terms, we sign a grant agreement with member states. Now we have 6 of them with whom we have signed such an agreement, and we coordinate with them what items and what quantities they buy and store for the European RescEU strategic reserve. What matters here is that at the moment of need, at the moment of severe crisis, it is the Commission that decides where such capacities need to be deployed and when. And the Commission will decide that on the basis of objective criteria in order to make sure that such capacity is available to member states that needs them most. On your second question, The situation in Lesbos following the Moria fires is extremely worrying. People were left without shelter, without food, water, sanitation facilities, and so on. Following a request from Greek authorities through the civil protection mechanism, we have immediately activated this mechanism, and in the following few days, following this request, more than 100,000 items, tents, blankets, and the like, shelter, water, sanitation items, were delivered to Greece in order to help alleviate this situation. This is a proof of the added value of the European Union Civil Protection Mechanism and of the solidarity of member states with Greece and, of course, with the inhabitants of the destroyed Moria camp. Thank you.
Thank you, Commissioner. I will continue with David Karata. I think there's an issue with the microphone. Try to press speak. We're waiting a bit for you to activate your microphone. Okay, if not, while David is trying to set up the IT issues, I'm going to continue with Thomas Speckshore.
Masks now in stock. Only the Netherlands need.
Thomas, we missed the beginning of your question. If you could restart.
Okay. Yeah, I restart. As I understood it, there is about 1 million FFP2 masks now in stock. Only the Netherlands needed in April and March and April 4 million FFP2 masks a week. So how useful is it to have 1 million now in stock for the whole of Europe, which needs even much more than these 4 million? Isn't this a symbolic gesture?
This is more than just a symbolic gesture, it's also a practical gesture. At the moment, it's true there is about 1 million FFP2 and FFP3 masks in the stock, but this stock will grow. This stock will grow both in Romania and Germany, which were first to offer their cooperation in the build-up of the RescEU. But we now have, as I said, 4 additional member states, so this figure will increase. However, these masks, in accordance with the philosophy of the civil protection, are not intended for general population. These are professional masks of high quality, which are intended primarily for the first responders, as I mentioned. These are medical personnel, these are civil protection teams and police and similar first responders. You will recall that in late February, early March, this was one of the key vulnerabilities in some of the member states where the medical personnel was required to work without proper protection. That's what we would like to avoid in the future, and that is the focus of RescEU when it comes to personal protective equipment.
Maybe a last question, since the midday briefing is about to start. I will give the floor to Philip Blenkinshop. Press speak, please, so we can hear you. We're almost there. We had a glimpse of you, Philip.
Oh, okay. It looked like I think I'm on. You mentioned that in terms of FFP2 and FFP3 masks, there was something like 1 million in store at the moment. Can you say what the plan is, sort of going into winter, how many you will have? Maybe you can just outline a little bit the conditions under which member states who are in urgent need of these masks, what conditions would they have to fulfill? Presumably also would they have to pay for them themselves, or would they get them for free?
Thank you. Assistance that is provided through the Union Civil Protection Mechanism, including the RescEU, is free. It is not for purchasing. So these masks would be distributed for free. How, when, and to whom? Such decisions will be based on the objective criteria that will take into account the data, reliable data, on the situation in the country concerned. That means the severity of the crisis, but also the obligation of every member state to have reasonable stocks of her own. Because I repeat, the RescEU concept does not absolve member states of their own responsibility for having reasonable stock in place in order to face such an emergency as, for instance, we are facing at the moment, the surge in the cases of COVID-19 in most of Europe. So the fact is that evidently the member states are now better prepared, but we can still not disregard a possibility that one or more of them would be overwhelmed in the coming months, especially due to the combination of the risk between COVID and the seasonal flu. So we need to be prepared. We are preparing ourselves. This initial stock will continue to grow. As I said, we just signed a grant agreement with 4 additional member states. So we'll have sizable RescEU reserve in place that will be available for extraordinary circumstances.
Commissioner, if you allow, I see one more hand up. So I will invite Nicolas Gros to ask his question.
Oui, bonjour, monsieur le commissaire. Vous m'entendez? Je peux vous poser une question en français?
Oui.
Parfait. Nicolas Gros-Véret de B2 et Sud-Ouest. J'ai bien entendu que vous vouliez maintenant doter RescEU de davantage de capacités, mais durant la crise, en mars-avril, on a vu que la Commission européenne avait eu des difficultés à décider rapidement la mise en place, le déclenchement, par exemple, d'équipes médicales en Italie. J'ai compté qu'il y avait fallu 6 semaines entre l'appel à l'aide de l'Italie et le déclenchement de ces équipes médicales. Je voulais savoir s'il y avait eu un espèce de retour d'expérience qui avait été fait pour permettre au sein de l'exécutif européen ou des institutions européennes d'accélérer les décisions et le déploiement des différents matériels. Et j'aurais aimé avoir un petit bilan aussi de ces équipes médicales déployées en Italie. Combien ont été déployées et combien de soins ont-elles effectués à l'époque? Merci beaucoup, monsieur le commissaire.
Si vous me permettez, je voudrais vous répondre en anglais. Ça marche? Okay. It is precisely the experience of late February and early March that led us to do what we have been doing on expanding the RescEU reserve. Previously, the European Commission did not have at its disposal a RescEU reserve of medical equipment, including personal protective equipment, because that was never considered by member states to be necessary, although ideas were floated to this effect already years ago. We entered the pandemic under the general impression that everybody will manage. We received signals from the member states that they are prepared. Until end of February, one member state ran out of personal protective equipment. And even more worrying, when that member state requested assistance, no other member state responded. The European Union Civil Protection Mechanism did its part. It activated the Civil Protection Mechanism, conveyed the Italian request to all other member states and called for assistance. It was not forthcoming because there was general shortage of equipment. Following which, the Commission immediately proposed an implementing act to expand the RescEU reserve, which until then only consisted of firefighting planes, because that was the agreement that we had from the member states, So we quickly, in 2 weeks, received an agreement from member states to expand this rescue so as also to include medical equipment and personal protective equipment. On 19th of March, this implementing act was published in the official journal of the EU and became legally in force. But that was a time, and you will recall, of general shortage of equipment, not only in Europe, but worldwide. There was a worldwide competition for limited supplies of the equipment. Nevertheless, millions of masks were sent to Italy. We received, as the Commission, donations from a couple of sources, and those donations we dispatched to countries that were most affected, first and foremost Italy, but also Spain, and thereafter some others. In other words, it took time for the Commission to be able to form such a reserve. Such a reserve is now in place and it is growing, precisely in order to avoid a situation that we had at the end of February. This has to be avoided. This is the lesson that we learned. This is the lesson that everybody has to learn. But the fundamentals remain the same. National competence includes responsibility for civil protection and preparedness for crisis. Member states are responsible for that. The Commission plays a supportive role. Since we could not support sufficiently the Member States, we asked to increase our tools, to increase our ability to support them, and this is now taking place so as to avoid the situation that we faced at the end of February and early March.
Thank you, Commissioner, for updating us on the state of play of the medical stockpile, and thank you for our viewers for tuning in and raising your questions. And now we will continue with the midday briefing. Thank you.